So endometriosis and fibroids affect your ability to get pregnant significantly. Now, fibroids could be located in, let's say for the sake of this discussion, maybe 3 main areas in the uterus. One is on the inner part of the uterus where the baby sits. So a fibroid can sit, if I use this as an example, right here. Okay? If the fibroid sits here, and this is the same space the baby occupies, then the fibroid is competing with the baby for that space. The fibroid effectively acts like a family planning. So when a pregnancy comes or tries to come, the fibroid says, hey, I'm here. I'm occupying the room. You can't occupy the room when I'm here. And so the pregnancy is unable to implant, and then you lose the pregnancy. It causes you, of course, it can mess up your cycle, so you can have prolonged bleedings. You might not be able to have sex at the right time to be able to get pregnant. It causes inflammatory fluid to be discharged into the cavity, creating a hostile environment for the sperm and for the pregnancy as well. So generally, what we call a submucous fibroid prevents you from getting pregnant. Now, the fibroid in the muscle, that is in the middle of the uterus, the middle here, not on the inner part, but in the muscle, the middle here, doesn't have the same effects as the fibroid that is the submucous fibroid. So this is what's called the intramural fibroid. That fibroid causes a different kind of problem. It can affect your implantation a little bit because it affects the normal contractility of the uterus, but not as much. This is the one that tends to make you have miscarriages. Because later on, if they are big enough, the uterus' ability to stay quiet is affected because of the presence of the fibroid, and your body is trying to push it out from where it is. And the result is that the fibroid will stay with the pregnancy will go. So, and especially the fibroids at the top of the uterus, it causes that kind of problem more than it's at the bottom of the uterus. So that causes the fibroids in the middle of the uterus in the muscle tend not to prevent you from getting pregnant, they cause you to lose pregnancies. Then there are fibroids which are on the outside of the uterus. So this is inside, middle, and outside. The ones on the outside, they tend to cause not much problems. So they tend not to affect your fertility at all. So that's to do with fibroids. The submucous ones are the main culprits in trying to get pregnant. With endometriosis, different kind of problem. Endometriosis causes an inflammatory kind of reaction. And endometriosis essentially is you having your menses not in the middle where the normal menses should come, where the middle of the uterus where the menses comes from, but now start having it in other places. And it could be on the outside of the uterus, it could be over the ovaries, it could be in your chest, it could be in your head, it could be in your eye. All those cases have been seen. But relevant to our case is where the endometriosis occurs in the pelvis and affects your tube by blocking it and preventing the tube from being able to grab an egg like usual, by affecting the ovary and destroying ovarian tissue, thereby preventing the ovary from being able to release the eggs, and then creating a general hostile environment. If that same situation of the endometriosis occurs, and this time it's not outside the pelvis, but it's in the uterine wall, in the middle here, is when we call it adenomyosis. That creates a very hostile environment here for the pregnancy, and therefore the pregnancy is not able to implant. It causes you to produce some yellowish kind of fluid, which is consistently flowing, which is not, even though you're not having your menses, just to produce not yellowish discharge. And that's when you have that, you suspect adenomyosis. And because of that, it makes it difficult for the pregnancy to implant. So anybody who's got endometriosis, stroke, adenomyosis, or uterine fibroids, we suggest that get an intervention done for them as quickly as possible. For the fibroids, the focus is on the fibroids which are on the inside of the cavity, which can be removed without cutting. Most people are afraid to remove the fibroid because they say you can cut. If that fibroid is removed hysteroscopically, that means you use a special machine through the vagina, through the cervix, into the womb, you can remove that fibroid and get out without cutting you anywhere in your body. And that's when you do that method, the fibroid heals the womb heals within maximum 2 months and can be time for a pregnancy by the 3rd month. And you don't have to have a cesarean section when you are having your baby. But what people are afraid of is the one that we have to cut you, and then for the next 6 weeks you are incapacitated, and then every time you want to have a baby they say you have to have a cesarean section because we've cut you. So there's no need to run away from the fibroid surgery purely because you are afraid that you have a cut on your body or you have to have a cesarean section when you deliver, because there are other methods of managing the fibroid without necessarily doing that. Well, I'm going to comment, so I'll talk mainly about women. Women think they'll always be fertile. Not true. Fertility starts declining basically from when you are born, but it declines significantly from the age of 35. And for most people after 43, their chances of getting pregnant is very, very low. We are talking about 3%. So it's really important that women should realize the fact that you can do anything you want at almost any age of your life, but you can't have children at any age. So it's really important that people should prioritize fertility, their fertility. For quite a number of people, they think it gets better over time, so they can wait for as long as they want. It doesn't work that way. There are problems too that if you notice that there's a problem, it's really important that you try and fix it, because trying to think that it will just go away, it doesn't go away. Like PCOS, you give them treatment, they get better, they start ovulating, their menses start coming regularly, then they stop taking their treatment. They say, oh, I thought it was gone. It's not gone. It's not gone. If you have a deficiency and we are giving you something that ensures your body gets what it needs to work, the moment you stop taking it, it's like you stop putting fuel in your car. What will happen? It will grind to a halt. You put fuel in your system, your system is not working very well. Then next thing, you stop putting the fuel. You can't stop. And that's the way it is for quite a number of these conditions. A woman can come, she's producing excessive breast milk. You give her medication, the breast milk stops. She starts ovulating, her menses comes back, she's happy. And she stops taking. She thinks she can just stop taking it and it will come back. No. I thought those things will come back. You have to maintain them down and just not let it go. So, and then some people just think that, as for getting pregnant, once you try, immediately you get pregnant. No, it doesn't work that way. Everybody has a 20% chance of getting pregnant every month, assuming they are normal. 20%. Normal people, 20%. That means 1 in 5. 1 in 5. So if you try this month and you don't get pregnant, you have to keep trying. And that's why we say at least 1 year. Because at least if it's 1 year, your 1 in 5 chance should have come by that time. If it doesn't come by that time, we think you have a problem. So that one too generally is there. Those are the main myths that I have encountered. But we can do all kinds of things. We check to see egg reserves, we check to see egg, to an extent egg quality, we check to see if the tubes are good, we check the sperm is good, we assess the endometrium. If there are things wrong with the endometrium, we work to fix it. If there are like adhesions, fibroids, things of that sort. Sometimes it's a stuck IUCD which is inside. I've had patients that IUCD was broken off, it was inside, we actually went in and removed it, she got pregnant. Hormonal tests, biochemical tests, tubal assessments, all of them. Basically, virtually all the tests that need to be done for fertility, we are able to do them and to be able to tell you if there are any problems. We encourage people to actually get tested even when they are young, not even when they are trying to have children, because occasionally you meet somebody and she's 28 and you have to tell her that your eggs are almost finished and you're going to be menopausal in a short while at this rate, at the rate that you lose. But you lose eggs, a lot of eggs every month. But some people lose a lot more. So they think they're fine, menses is coming, and if so, for some reason we check, you discover that they actually don't have many eggs. So the concern is, it is good to test to know that I'm okay, I have time, or I'm not okay, I don't have time, and therefore I must, take certain steps or interventions to ensure that I can maintain my fertility rather than allowing it just to go away. After the assessment, then we know what your problems are. Then based on the problems, we can offer you options. If it's an ovulation problem, there's ovulation induction, that alone. Ovulation induction with artificial insemination, if we think that would be of greater benefit for you. If your tube is blocked, if the sperm has a problem, if the egg has a problem, prolonged infertility, we can't find the cause. Another option that can available is an IVF, where we take the egg from the woman and the sperm from the man, combine it and get a baby, and then put it inside the woman. There's also, you can do ICSI, where you can get the sperm and inject it into the egg for those who've got significant sperm problems. For those people who have difficulty in producing the sperm, you can actually go into the testis and pick the sperm and combine it with with the egg, and then for you to have a baby, we do embryo freezing, we do egg freezing, and we offer surrogacy services too as well. We have a fertility assessment package, and the objective is that you come, we do one set of tests for you, and at the end of which you know exactly where you stand with reference to your fertility. We've tried to make it as comprehensive as possible, but that also not being excessive, so that because we can, a lot of people come and they put a lot of questions that they need answered, and if you can do the right set of tests, you can actually say this and this and this are what your challenges are, and then she has an opportunity to decide if she wants to address them and when she wants to address them, or that you are okay, so for the next couple of years you should be okay and there shouldn't be a problem. So it can be done in maximum 2 visits, and you can do all your assessments during that period of time. We try to make it so that you don't have to come too many times, and it's not painful. Be healthy, live healthy, eat well, have a good general life, because sometimes 50% of all pregnancies are unexpected. I won't use the word unplanned, let's just say unexpected. As a result, if you're not healthy before you've got that pregnancy, then we have challenges because your health is not already good. The first 3 months you can't eat very well, the baby just takes from you. It's a very effective parasite, so that is a problem. I encourage people that when you get married first, enjoy your honeymoon small, because once you get pregnant, your world changes. It's no longer the way it used to be. So they should do that. If you know you intend to get pregnant, we would advise that you intend to get pregnant, you see your doctor for a preconception visit, where they just check you out and make sure everything's okay. You go and try. Or there's a problem, we need to fix this. A lady came here and we checked her sugars. Her sugar was like 26. She's in her 20s. Her sugar was like 26. And we are talking about sugars that should be ideally maximum, after all the food you've eaten, 8. And she was at 26. So getting pregnant in that state would have been terrible. Getting her fixed before she gets pregnant gives us a very good chance of having a safe and successful pregnancy. But have your children early. It's better.